Good morning, good afternoon, wherever you are in the world. Hello to our audience. You're very welcome to Kingston University's webinar on our nursing courses at undergraduate level. I'm shortly going to hand over to Kris Paget, who's Senior Lecturer for Adult Nursing within the faculty. But before I do, just a couple of house rules. Kris is going to be taking you through a presentation about the various nursing courses we have here at Kingston. And then once she's done that, we're more than happy to take questions from audience members. We're very lucky today to have a current nursing student, Naeem. He's with us to answer some of your questions. So please do feel free to stick around once the presentation is finished, and Naeem and the rest of our team will be more than happy to answer those. You should see on your screens a couple of options. There's the option to raise your hand. There's also an option to chat. But with the questions, if you have any questions, we prefer it if you put those on the Q&A option. So on your screens, you'll see an option that says Q&A. If you could post questions to that, then one of our team will get an answer back to you. If there's a recurring question that keeps popping up, we'll maybe jump back onto the audio and answer that in person. But without further ado, I'm going to hand over to Kris Paget.
Hello, this is Kris Paget. I'm a Senior Lecturer in Adult Nursing at Kingston University, St George's University, London. I first would like to make it clear regarding nursing in Britain, or training to be a nurse in Britain, United Kingdom. We do not have a generic programme. We have fields. So we have 4 fields, and all 4 fields are available at Kingston University. So that's mental health nursing BSc honours, learning disability nursing BSc honours, child nursing BSc honours, and adult nursing BSc honours. So it's quite important that applicants identify on their application which field they want to go into. I'd like to start first with a few little highlights regarding why should you consider Kingston University. Well, we're award-winning learning experiences, particularly our simulation labs, which were highlighted in Nursing Midwifery Council audit of the university a couple of years ago. Our award-winning students, our students are also achieving recognition for the work that they're doing and what they're achieving on the course. Over the last 5 years now, all our students, or some of our students, have been shortlisted in the Student Nursing Times Awards. Award-winning teaching staff. We've got very pleased to have on our teaching staff Professor Ian Peat, OBE, who has been awarded by the Royal College of Nursing Outstanding Contribution to Nursing, and he is an active teacher on our courses. International placement is embedded and part of the degree. We do a lot of collaborative learning, which is embedded in the curriculum. This is learning with other professionals and other students from other professions. So we're talking about medical students, physio students, pharmacology students, and again, it's building up the confidence and embedding within our students who they are as a nurse, a registered nurse. We also have embedded within our curriculum linking art to science, and that's exposure to external organisations and projects to encourage students to have a broader understanding of other issues and topics that on the face of it may not be completely related to nursing. It's for instance, it's exposure to trips to the microbiology labs, the Foundling Hospital, all things like that. One of the latest practice areas, Pan London, or rather one of the largest practice areas, Pan London, we have multiple specialities that our students can learn from. And also, I have to mention about the location of the nursing school in Kingston upon Thames. We pride ourselves that we're in the country, but in fact, we're only 20 minutes away from central London, and we're right on the river. And that definitely adds to the ambience of Kingston University and learning here. Firstly, I'd like to go through our requirements for admission onto our courses. on all fields, we require a level 3 qualification, which is equivalent to UCAS points 112 or 3 A-levels BBC. We're receiving an awful lot more international baccalaureate candidates, which is excellent. We love that course. But we do expect to have a science topic within that. And again, we're looking at 32 points. Also at level 2 qualifications, we're like equivalent to 5 GCSEs, which is grade 4C or above. This must include maths, English language, and a science subject would be preferred. However, we're very easy about looking at students or applicants that have got a level 2 qualification in, for instance, psychology and are interested in going into mental health or learning disability. For non-native speakers, we do expect an ELTS score of 7. The admission process, all our applications are via UCAS. A very important aspect of the admission process is the personal statement, because it needs to meet the nursing midwifery, the NMC guidelines. What we expect within the statement is the candidate expressing why nursing. Why have they chosen the field? And what are the challenges or the realities of that field? We also like to know about their experiences of care and include applying their qualities and attributes. What did they learn in their experience of care? And don't forget, this is definitely not just in a hospital setting. This can be in projects they've been involved with at church. It's extracurricular activities in high school, where they've been meeting other people, people that they've helped, whether it's communicating with them, that kind of thing. Also, identify personal achievements and social involvement. We like to think our students are aware that there's a bigger world out there. There are lots of different social groups, cultures, and what do they understand about that? And how have they reached out? And that could be possibly part of their experience of care. The admission process for international applicants, all our interviews are via Skype using a value-based recruitment model. Before the interview, reading materials, preparation materials will be sent to the candidate. Value-based recruitment is very much based in that we want to see the qualities and attributes that applicant has. So they will be asked questions, they'll have a scenario where they're able to show their reasoning skills, decision-making skills. It's that they express themselves well, that they're non-judgmental. So that's what we want to see in that. As a vocational qualification for September 2018, admissions will be considering international applications up to mid-August. But I have to point out and stress the undergraduate nursing year starts in the second week of September. So considering about submitting applications, being interviewed, and being able, if they're successful, be able to be ready and in the country for September, the start, they have to be realistic looking at that. Fees and what is included. Well, currently for 2018, undergraduate fees is $14,200. But what do you get for it? Well, our students will receive the practice uniforms. These obviously meet health and safety requirements, professional requirements. Also, it's the initial processing costs of the DBS, which is the disclosure and barring service, will be met by the university. However, we do recommend students subscribe at their own cost for further professional development, because this will take them right through up to when they get their first job in practice. All practice placements are arranged by us, Kingston University. All right. Okay, so well, welcome to the School of Nursing. I'd like to identify that, again, one of our pluses at Kingston University is our very unique relationship that we have with St George's University, London. This affords us a lot of co-learning. Our students are actively involved right from the first year, working and learning with pharmacology students, with the physio students, social work students, and as they progress through the years with the medical students. No other universities, or very few universities, offer that, and certainly it encourages the student to start thinking about who they are, regard their professional values, and who they are within the multidisciplinary team. Thinking about what we've achieved regarding teaching and putting together learning packages for students. Kingston University was named among the top 500 institutions globally for clinical and health education, and that was by the Times Higher Education. Also, last year, the end of last year, we were awarded the Guardian University Award for Teaching Excellence. And again, that was the packages that we put together to enhance our student learning, which included more access to podcasts, interactive materials, not just reading or attending classes. Also, it's not just us, our students are achieving. I'd like to highlight that for this year's Student Nursing Times Awards, we've been nominated in 8 categories, and 4 of those categories, it's what our students have achieved. And that's a reflection of the work, the commitment that they're putting into their course, and what they're actually getting out of it as well. If I go on to practice, 50% of a nursing programme in the United Kingdom is practice. So practice is very important. Over 700 practice hours each year are all in blocks. And currently there are 2 blocks per year. And how that looks at, the reality is that the students will have a block for, say, 6-8 weeks of theory. Then they could have annual leave for a couple of weeks, and then they go out in practice for a block. So that'll be 6 weeks or even 10-12 weeks. And then they would have annual leave blocks, reading weeks, annual leave again. So it's very clearly identified regarding their blocks of when they're going out or when they're at university. The university will arrange all practice placements. So these are our key areas that I'll highlight in a moment. It's to enhance the students' learning experience, and again the importance of linking theory with practice. The students are supernumerary, so there will not be an issue regarding infringement on visa, because it is obviously part of the award of the degree. Accommodation is not required on site of placements. The students will live in halls or student accommodation, or if they go out and have a private placement, flat share, house share. So that is not required. They can travel from where they're actually living to placements and home again on that day. We have a diverse specialities which reflect the field, and again we want to expose our students, regardless of what field they're in, to as many specialities as possible, because we need to develop an all-rounded registered nurse at the end of their programme. Also regarding practice is their international placement, and again our students, because this is an element of the degree, there are no problems regarding their visa or change of visa, and I'll go into international in a minute. If I could just quickly go over the 4 fields, so very clear about what the 4 fields are. Mental health nursing, BSc, the focus is on mental health nursing is a recovery thus enabling the person to attain their goals and desired quality of life. Our mental health student nurses on placements, they could go to, for instance, the child and adolescent mental health services. So that's based within some institutions, as well as in children, young people in their own home. So sometimes that's behavioural issues. It can be following up students in school, at college, that kind of thing. Forensic mental health services, obsessive compulsive disorder services, that again is either embedded within the community, but we also have specialist placements like Trinity that is dealing with young people that have eating disorders, straight through to older people, adults, that have behavioural activity dependency, whether it's alcohol, gambling, that kind of thing. There's the personality disorder services, which is heavily linked to the Springfield Mental Health Southwest London Trust, as well as acute mental health interventions team. These are people who are based, whether it's in accident and emergency, in police stations, to go out and meet patients when there is a crisis regarding their mental health condition. The picture there is just highlighting our mental health team that won an award in 2016 for innovation in mental health teaching. For child nursing, the programme will provide the student with practical knowledge and hands-on clinical skills to care for a child or young person. So this is from birth to young adulthood. This is very much in partnership with the family in hospital and community settings. Some of the placements could be the Shooting Star Hospice. So children that are end of life, have got life-shortening conditions. They also offer support with children that have got long-term conditions, deteriorating conditions, so for symptom control, pain control, things like that. Great Ormond Street Hospital, hopefully you've heard of that, a world-renowned specialist hospital for children. St George's NHS Trust Hospital for acute and critical care of children. Also the Chelsea Westminster NHS Hospital Trust with their specialist burns unit. And obviously the children's student nurses will be working with specialist nurses, for instance the sickle cell disease nurse specialist. We've got a picture there regarding the Museum of Childhood, and this is very much again linking art with science, broadening our perceptions as student nurses of other issues that are fundamental and support our delivering of care in practice. Adult nursing BSc, so this is adult nurses, it's care to people from the age of 18 years old to end of life. Patients obviously have a wide variety of health conditions, illnesses and injuries. This could be in a critical, acute or a community setting. Our adult student nurses placements, for instance, the Royal Marsden NHS Foundation Trust, again, a world-renowned cancer care and research hospital or hospitals. So yes, St George's NHS Hospital Trust with acute and critical care. So students there would be with acute patients with long-term conditions right through to critical care. So working with practitioners in intensive care units, high dependency units and accident and emergency. There's Your Healthcare, for instance, working in community. So that's not only looking after people with long-term conditions in their own home with specialist care, diabetes, but it's also looking after people in care homes and retirement homes. Specialist nurse, pain management, diabetes nurse specialist, and also Wandsworth Prison, which is a very, very popular placement for our students. They really learn a lot there. And particularly with people who are withdrawing from substances. So yeah, and part of your course here within the adult nursing is obviously your advanced skills. So venipuncture, cannulation, that can full physical assessment. So yeah. Learning disability, so very much about the health and well-being of people with a learning disability across the lifespan. Some people in areas in the world would call it learning rather intellectual disability. Here it's placements include the Children's Trust, which is the rehabilitation, I beg your pardon, for children and young people following a brain injury. It's The Deacon unit, again, very well-known unit regarding supporting interventions with people with complex needs. It's with disabilities, learning disabilities. Again, the Great Ormond Street Hospital, specialist hospital for children, and also the community disability team. So very much at the forefront, supporting people who with a learning disability living in the community, living in their own home, or smaller organisations or joint homes. There we've got the Baked Bean Company. As part of learning in practice and simulation, is that we bring in a theatre group that is made up of actors who have learning disabilities, and again they're part of teaching our students to develop their skills in complex situations. So careers and progression, passing through your nurse training. On successful completion of the programme, students are able to register with the Nursing Midwifery Council, allowing them to practice in the United Kingdom. Registered with the Nursing Midwifery Council, graduates can migrate their visa and obtain work in the NHS. Nursing BSc Honours is an international recognised qualification, and consequently some of our graduates are working as a registered nurse abroad. We have students recently who are graduated who are working in Canada, India, Australia. We have one of the highest employability rates pan-London. Currently, it's 99% of our students are in work immediately following their graduation. That's to follow the completion of the presentation. So hopefully you've got some questions that were here that we can answer for you. If you require any other information, you can't think of anything to ask us currently, please contact us on the email that's on the last slide.
Okay, audience, once again, thank you very much for attending the webinar today on our nursing courses at Kingston University. Just a reminder, if there are any other questions remaining that you have for us, please feel free to send them in via the email address that's on your screen at the moment. That's internationaladmin@kingston.ac.uk. And one of the team here will pick that up for you and point it in the right direction. So once again, thank you very much for joining us, and we hope to speak to you, hear from you soon.